Hello, my name is Allison Plata. I am a recent graduate of the Clinical Nurse Specialist program at Kent State University. My title of my project was CNS Intern plus EBP plus Lean Six Sigma equals a nurse-driven telemetry discontinuation protocol. The reason why this project was initiated was we looked at the frequency at which we were doing telemetry strip mounting and measuring of the telemetry strips. And we realized that we were, one, doing that too frequent, which led me to look at the overall usage of telemetry, and I realized that our telemetry is not AHA or ACC compliant. Down at the bottom left, you'll see my little bar, graph there that 50% of the orders that I looked at, I manually audited, they did not find a reason as to why the patient was on telemetry. There was no documentation from either nursing or the provider as to why the patient should be on telemetry based off of an ACC or AHA criteria. The other 25%, the red, was actually that nursing was keeping the patient on telemetry. However, the patient should not have been on telemetry because there was no active order for telemetry. And then the green 24% or 25% roughly was that the patient actually had a valid AHA or ACC reason for being on telemetry. So that's what kind of led me into looking at that. So then I completed the EBP portion and I developed a PICO, and my PICO was in non-ICU telemetry units. What are best practices for telemetry monitoring as compared to current practice, and how did that affect the outcomes? So I looked at 10 total articles, and the top things that I found in the literature were that a nurse-driven discontinuation protocol and to align them with AHA and ACC criteria for them. The outcomes were related to the number of hours on telemetry, those or days on telemetry, depending on how they recorded the time within the literature, all decreased. And then another outcome that was measured was the number of rapid response or code blues, and those did not change within those studies either. And so that led me to look at the actual nurse-driven telemetry discontinuation protocols that they had within those. There was about 5 of them that actually reported it, and I developed a nurse-driven telemetry discontinuation protocol that's in the top right. That actually was vetted through the Nursing Executive Committee and also the Medical Executive Committee, where nursing actually has the power to remove the telemetry based off of the criteria. It starts at 48 hours for that order. For them to be able to start looking at it. If they meet that criteria, the nursing is empowered to actually remove that with that order set. One of the changes that we implemented also was that within the EHR, of limiting the time for the order set, so it has to have a time frame of 72 hours, and the provider does not have an unlimited amount of time, because one of the other things that we found was that the order was actually on the entire time the patient was admitted, so it matched the length of stay for those patients. And so we are continuing to work with Epic to create this within our system of managing it and looking at length of stay, overall telemetry utilization, and then the nurse-driven portion that we're monitoring, that nurses are empowered to be able to remove telemetry for those patients. Thank you very much, and I'll be looking forward to any and all questions.